The skull, in the correct use of the term, includes the cranial and the facial bones. The bones of the cranium have a number of important functions. They protect and enclose the brain and special sense organs like the eyes and ears. Muscles for mastication or chewing and muscles for head movement attach to certain cranial bones. At certain locations, air sinuses or cavities are present that connect with the nasal cavities. All of the individual bones of the cranium are united by immovable junction lines called sutures. The following picture shows a posterior and anterior view of the bones that will be discussed today: the skull, thorax, and vertebral column. The frontal bone is a single bone that forms the forehead, the roof of the nasal cavity, and the orbits, which are the bony sockets that contain the eye. The coronal suture is found where the frontal bone joins the two parietal bones. The two parietal bones form the upper sides and roof of the cranium. The occipital bone is a single bone that forms the back and base of the cranium. The inferior portion of this bone has a large opening called the foramen magnum, through which the spinal cord connects with the brain. On each lower side of the occipital bone is a process called the occipital condyle. These processes are significant because they articulate with depressions in the first cervical vertebra, allowing the head to connect with and rest on the vertebrae. The two temporal bones help form the lower sides and base of the cranium. Each temporal bone encloses an ear and bears a fossa for articulation with the lower jaw or mandible. They are composed of four parts: squamous portion, which is the largest and most superior of the four parts. Projecting from its lower part is a zygomatic process that forms the lateral part of the zygomatic arch or cheekbone. The petrous part is found deep within the base of the skull, where it protects and surrounds the inner ear. The mastoid portion is located behind and below the auditory meatus or opening of the ear. And the mastoid process is a rounded projection of the mastoid portion of the temporal bone, easily felt behind the ear. Several muscles of the neck attach to this mastoid process and assist in moving your head. Finally, the tympanic plate forms the floor and anterior wall of the external auditory meatus. The single sphenoid bone forms the anterior portion of the base of the cranium. The single ethmoid bone is the principal supporting structure of the nasal cavities and helps form part of the orbits. The 6 auditory ossicles are the 3 bones found in each ear: the malleus, stapes, and the incus. The 2 nasal bones are thin and delicate bones that join in a suture to form the bridge of the nose. The 2 palatine bones form the posterior part of the roof of your mouth or part of the hard palate. The 2 maxillary bones make up the upper jaw. Each maxillary bone consists of 5 parts: a body, a zygomatic process, a frontal process, a palatine process, and an alveolar process. The palatine process extends posteriorly in a horizontal plane to join or articulate with the palatine bone and actually forms the greater anterior portion of the hard palate or roof of the mouth. The 2 zygomatic bones, also known as the malar bones, form the prominence of the cheek. Each zygomatic bone has a frontal process extending upward to articulate with the frontal bone and a smaller temporal process that joins laterally with the temporal bone, thus forming the easily identified zygomatic arch. The 2 lacrimal bones make a part of the orbit at the inner angle of the eye. Their lateral surface has a depression that holds the lacrimal sac or tear sac and provides a canal for the lacrimal duct. The 2 turbinates bones are very thin and fragile. There is one in each nostril on the lateral side. They help form a series of shelves in the nasal cavity where air is moistened, warmed, and filtered. The single vomer bone is a flat bone that makes up the lower posterior portion of the nasal septum. The single mandible bone develops in 2 parts. The intervening cartilage ossifies in early childhood, and the bone becomes fused into a single continuous structure. On each side of the body are the rami that extend perpendicularly upward. Each ramus has a condyle for articulation with the mandibular fossa of the temporal bone, thus allowing for the wide range of movement of the lower jawbone. The following tables showcase the different bones found in the orbits and nasal cavities, ones already discussed. And lastly, for the cranial bones, there is a single hyoid bone that has no articulations with other bones. The sternum, ribs, and vertebrae make up the trunk or torso of the axial skeleton. The vertebrae are rigid and provide support for the body, but the fibrocartilaginous discs between the vertebrae allow for a high degree of flexibility. The discs and vertebrae protect the delicate spinal cord contained within their articulated channels formed from the successive foramina. The spinal column is formed from a series of 26 irregular bones called vertebrae, separated and cushioned by the intervertebral discs of cartilage. A typical vertebra has the following parts or features: the body, the spinous process, quite large on the thoracic vertebrae, directed backward, and 2 transferred processes, one on each side of the vertebra, among others. The articular processes are used for articulating with the vertebra immediately above by the 2 superior articular processes and with the vertebra immediately below by the 2 inferior articular processes. Providing protection for the spinal cord and support for the body, the vertebral column is also built to withstand forces of compression many times the weight of the body. The cervical vertebrae are the smallest vertebrae. The first 2 have been given special names. The first is called the atlas. It supports the head by articulation with the condyles of the occipital bone. The second vertebra is the axis. It acts as a pivot on which the atlas and head rotate. The thoracic vertebrae have 2 distinguishing characteristics: the long spinous process pointing downward and 6 facets, 3 on each side for articulation with a rib. The lumbar vertebrae are the largest and the strongest. They are modified for the attachment of the powerful back muscles. The sacrum is a triangular and slightly curved bone. The curving coccyx can move slightly to increase the size of the birth canal during delivery in the female. When the posterior curvature of the spine is accentuated in the upper thoracic region, the condition is called kyphosis. This results in the commonly referred to condition called hunchback. It is particularly common in older individuals due to osteoporosis. It can also be caused by tuberculosis of the spine, osteomalacia, or rickets. Lordosis, or swayback, is an abnormal accentuated lumbar curvature. It can also result from rickets or spinal tuberculosis. Scoliosis, meaning twisted condition, is an abnormal lateral curvature of the spine that occurs most often in the thoracic region. The 12 pairs of ribs are also referred to as the costae. They are named according to their anterior attachments. Because the upper 7 pairs articulate directly with the sternum, they are called true ribs. The lower 5 pairs are called false ribs. The costal cartilages of the 8th, 9th, and 10th rib pairs are attached to the cartilage of the 7th rib, so they join the sternum only indirectly. Because the 11th and 12th pairs of ribs have no cartilage and do not attach at all anteriorly, these false ribs have another name: floating ribs. The sternum develops in 3 parts: the manubrium, the gladiolus, and the xiphoid bone, as shown in the picture. No ribs are attached to the xiphoid, but the manubrium and gladiolus have notches on each side for attachment of the first 7 costal cartilages. The manubrium articulates with the clavicle or collarbone.